Hi guys, this is Dr. Moore with ND Direct Docs. I am here today with Nicole van Klompenburg, an IBCLC or lactation consultant and dietitian that I've known for many years. We teach together a lot and we also work together on a lot of patients. And I think we've both learned a lot over the years about the differences in our training and scope of practice. And sometimes it surprises people that we actually refer patients to each other, even though we both take care of breastfeeding babies and moms. So what's been your experiencing with that? How do you pick when you send a baby my way?
I'm so thankful to have a breastfeeding expert in the field of physician to have people to refer to. So having Dr. Moore in this specialty is fantastic, and it really helps my practice because as an IBCLC, I'm trained to, I can do latch, a poor latch, a low milk supply, and helping with pumping and a lot of concerns that are just very focused on the breast milk and the breastfeeding and infant feeding. But when there's something that's just a higher level that goes into it, so if there's like a cleft palate, or if there's severely low milk supply, that might be something physiological going on with the mom.
More than just needing to pump more often,
there's just certain cases where there's just something that's significantly more complicated than what we're trained to do. It's so great to have someone to refer out, because otherwise you're kind of like, well, I could try this or that, but I don't know that the right path going forward. And so if you can refer someone who can very quickly look at someone and say, here's the steps you should go through, 1, 2, 3, I can then do the follow-ups with them and teach them more in depth about how to do that. Take a little more time, still do some home visits with them, and support them through that period, but I don't have to do as much of the guesswork and worry that I may be missing something bigger picture in their medical.
Yeah, that makes a lot of sense, because that's where we've done a lot of patients together. And I love that usually if she's able to, Nicole actually arranges to come to the visit that I have with her clients, because it lets her get to give her input, right? And she picks up on things sometimes that I don't know because she's been in the home. And it does let us kind of discuss the plan, and then you're able to just communicate with me if things aren't going the way we thought they would. And then you can also help the parents figure out, do they need another visit? So I think a really common example that you and I take care of together is when we're dealing with what I would term dysfunctional milk extraction. So something is making the baby not capable of drawing the milk that is there out of the breast. And that can be really complicated. It can have all sorts of factors, whether it's something about mom's breast, something about baby's mouth, whether it's the palate or the tongue, all sorts of things. Sometimes it's a baby with a more rare congenital or neurodevelopmental complication that plays a role in their feeding plans. And it is really helpful, because then I can help make that plan. And then I love hearing later about how you see them for follow-up, and you're able to help them stay at the home and not come visit me in the office as often, but that you feel like you are supported. So yeah, I think that's exactly what I would say. We've both done lectures together also, and it's sort of similar when we do lectures for other doctors and things like that. I can teach some of the more physician level differential diagnosis and all those kinds of things that is my training. And then you have a lot more of sometimes the practical tips and how you help parents in the home. I can latch a baby too, but you're really good about sticking with them and going to those follow-up visits and taking care of that part that I'm not there for. So yeah.
I think there's value in both.
Absolutely.
Lactation consultants have a role that's really important in families, but then there's that next level of, if it's outside of my scope of practice and I'm unsure what to do, I really need a resource like Dr. Moore, and now I have it, which I don't think the community, I haven't found a resource until I found Dr. Moore, to have that higher level of a referral too. So.
Yeah, I'm really happy that now that we've opened ND Direct Docs and I'm doing breastfeeding consults, that we're able to extend that reach to a lot more moms who we weren't able to.
And be really
before.
Accessible now. It's not it's a little easier to
it's a lot easier to get in with me, because we don't have to ask permission of anybody or ask what your insurance is. I just am like, oh yeah, we have a visit tomorrow.
Get them in fast.
Yes.
We can kind of arrange it so that I can come at the same time. So we're actually coordinating a lot of schedules, but we can still accommodate it right now. So it's actually really convenient for the families.
All right. Well, again, that was Nicole, and she is one of the lactation consultants I've worked with the most, so I often do refer to her as well. I am happy to meet more of our lactation consultants out in the community. We just wanted to let you guys know a little bit about how we work together. Have a great day.